Thank you for joining today's brief yet important webinar on our nation's transition to ICD-10 and the technologies that are available to help facilitate this daunting change. My name is Dr. John Juliana, and I am not only a healthcare provider, but I'm also a practice management consultant who guides physicians on how to leverage technology to maximize their workflow. Today I'm going to discuss some of the broad changes and differences between ICD-9 and ICD-10. But more importantly, I'm going to highlight the technologies that are available that will help assist you in getting your claims paid and therefore prevent compromises in your practice's vitally important cash flow. You're going to learn the differences between ICD-10 readiness and tools such as crosswalks and gem mapping software, and how they differ from true solutions that not only enable you to select the most specific ICD-10 code, but also does so in a very efficient workflow manner. It's only a true technological solution, such as the SmartSheet10 technology, which I will discuss today, that will not only prevent claims from being rejected, but will also help contain the cost associated with this transition due to its integrated workflow focus. Let's first talk about some rather recent developments that affect our 2015 through 2016 transition challenges. We now know definitively that ICD-10 begins on October 1st of 2015, but at least Medicare has defined some changes to their adoption mandate. Medicare now calls for providers to use ICD-10 codes that are at least in the correct family of the proper diagnosis in order to get the claim paid. This one-year so-called family flexibility rule is supposedly designed to ease physicians into the mandate of submitting the most specific code come October of 2016. This family flexibility rule means that you must submit at least the first 3 characters of an ICD-10 code in order to get your claim paid by Medicare. So as a 2015 example, and this is not my example, this is actually an example that Medicare uses, but it would be applicable for all orthopedic codes. If you were to see a patient with Hodgkin's lymphoma and you consider all of the ICD-10 codes for Hodgkin's lymphoma, such as C81.00, C81.03, C81.10, etc., you can simply submit C81.00 and get paid. For 2015, you will not need any more specificity other than C81.00. As a healthcare consultant, I urge all of you to be very careful in how you view this family flexibility rule. It's truly setting healthcare providers up for bad behaviors, behaviors that will be very difficult to change when 2016 arrives, and specificity will be mandatory to prevent your claims from getting rejected. Furthermore, please remember that C81.00 will get paid, but C81 will not. And to complicate matters even further, it's only Medicare that has this flexibility rule. Neither Medicaid nor private health payers have given such flexibility, and specificity will absolutely matter to get your claims paid. So as a result, a year from now, I doubt that many physicians are going to look back and be happy that CMS created this one-year flexibility rule. For those of you who play golf, you understand that the habits you develop early on in your game are very difficult to break. Developing the right habits and strategies from the onset is crucial for success. So now let's turn our focus to some of the broad differences between ICD-9 and ICD-10. ICD-9 is made up of mostly numeric characters, which are usually 3 to 5 characters in length. There are about 13,000 ICD-9 codes. In contrast, ICD-10 is always alphanumeric characters, usually 3 to 7 characters in length, and comprised of about 69,000 codes. So therefore, you could begin to see how much more complex ICD-10 is and why this transition can be challenging. Having technology to assist in this transition is crucial. As a healthcare consultant, I am always focused on the cost associated with business processes. If we look at 3 different optional processes to identify the most specific ICD-10 code from an ICD-9 code, it really comes down to either books, tools, or solutions. Since there are literally 21 chapters involved with the ICD-10 books, utilizing them is going to not only be a daunting challenge, but an expensive option due to the cost of human capital and workflow inefficiencies. I truly don't consider the ICD-10 books a viable option. Tools are much better alternatives to books since they at least provide an electronic means of searching for the code. Yet they're still workflow disruptive and will lead to escalating operating costs for a typical medical practice. Technological solutions, on the other hand, for which the SmartSheet10 technology is the most innovative, not only provide the most specific code necessary to get the claim paid, but does so in an extremely workflow compliant manner. As an example of one reason that books and tools are inefficient, some codes actually require a unique 7th character, such as fracture codes shown here. The provider must indicate whether this is an initial encounter, subsequent encounter, or a sequela, meaning that the fracture is as a result of some other pathology. Books and tools are very ineffective and inefficient at arriving at this level of complexity. Let's talk more specifically about the differences between tools and solutions. One of the most well-known tools is known as the General Equivalence Mapping Program, or GEMS program. These programs often work very well when there's an exact match between ICD-9 and ICD-10 on a one-to-one basis. Unfortunately, that's often not the case. There is often a one-to-many match between ICD-9 and ICD-10. So a GEMS program will likely get you to the neighborhood that you need to be in terms of the ICD-10 code to get that claim paid, but they often fail to get you to the street of that neighborhood and most importantly to the exact address of the street necessary to get the claim paid. Once again, using a technology that can adversely affect your claim rejection rate will ultimately lead to cash flow problems for your practice. Getting to that most specific code in an efficient workflow manner is crucial for the financial health of your practice. While many of us providers felt that meaningful use in PQRS disrupted our historical workflow, they're merely speed bumps relative to the brick wall that ICD-10 will create. While noncompliance with meaningful use in PQRS will lead to penalties, noncompliance with ICD-10 will lead to a complete cash flow shutdown for your practice. So now let's turn to the technological solution that essentially will help make this transition seamless for you and your staff, the SmartSheet10 technology. Before I show you how the SmartSheet technology works, please keep in mind that this is a technology that will deliver the most specific ICD-10 code in the most efficient workflow manner, which can be integrated into your electronic health record so that the selected code can populate your patient's claim. It's truly both EHR as well as specialty agnostic. As I open the Smartsheet database, the left-hand side of the screen shows the search engine where I could type in any ICD-9 code. In this instance, I'm typing in 354.0, which is the ICD-9 code for carpal tunnel. What happens instantaneously on the right-hand side of the screen is that it takes me to the exact chapter of the ICD-10 book where carpal tunnel is located. Notice that the chapter heading is black and the code selected on the top remains red, indicating that I'm not yet at the most specific code for carpal tunnel. If I open up the chapter, green codes appear and I simply need to make my choice of laterality, either right limb or left limb. Using the Smartsheet technology, only the green codes are at their most specific level. Once I make my choice of the right or left limb, notice how the selected ICD-10 code at the top of the screen also turns green. If this were integrated into your electronic health record, it would now also be ready to populate your claim. Let's take a look at another example, this time using 716.11 or traumatic arthropathy. Once I type the ICD-9 code into the search area, once again on the right-hand side of the screen, it automatically takes me to the exact chapter in the ICD-10 book where traumatic arthropathy resides. It's important to note that if I didn't know the ICD-9 code, I could use the text form of the search by typing in the diagnosis word. Once again, making my laterality selection causes my selected code to turn green, and this claim is ready for submission. If I were to type in 845.0 or sprain of ankle, it takes me right to the precise chapter again in the ICD-10 book. But this time, when I try to click on right or left ankle, the SmartSheet10 technology intervenes. I immediately get a pop-up alert indicating that this is one of those codes that require a unique seventh character. I must provide information and specify whether this is an initial encounter, a subsequent encounter, or a sequela. The SmartSheet technology simply prevents me from making any mistakes. The same thing happens with fracture of metatarsal. If I type in the ICD-9 code for fracture of metatarsal, or in this instance, the actual word, it takes me to the exact chapter heading. Trying to select laterality again causes a pop-up alert indicating that I need to submit whether this is initial, subsequent, or sequela visit, and the status of the fracture healing if it's a subsequent visit. Through simple color-coded clicks, only after I indicate that unique seventh character does everything turn green in the selected code area on top. As a management consultant, I am keenly aware of the enormous cost that workflow might cause a practice. The Smartsheet technology allows for a seamless workflow not only because it can be integrated into any electronic health record, but also because it allows for the creation of a provider-specific, customized super bill. This allows all providers to very quickly identify the proper family of ICD-10 codes and simply by clicking on their super bill, arrive at the most specific level of that code. Very quickly, I can create my very own super bill from a list of ICD-9 codes. The technology converts them to ICD-10 and then allows me to use the entire functionality of Smartsheet 10. For the purpose of this demonstration, I've selected only a few ICD-9 codes to create my ICD-10 super bill. Now when I use my efficient super bill, once again the technology takes me to the exact chapter that I need to be in where I'll find the green specific codes. The Smart Super Bill, when integrated into your electronic health record, allows you to continue the same workflow that you might have used for years in your billing process. Highly effective and highly efficient. One last important feature that needs to be discussed about the Smartsheet 10 technology is the concept of dual coding. Simply clicking on my superbill, the technology will provide dual coding of both the ICD-9 as well as ICD-10 code, allowing me to determine which is the proper code based on the date of service or insurance carrier. Dual coding is important since not every carrier will be ready to transition to ICD-10, as well as for the dates of services that actually precede October 1st, 2015. Those services must be submitted with an ICD-9 code regardless of the date of submission of that claim. I hope this demonstration highlighted for you not only the fundamentals of ICD-10, but also how technology is available to significantly reduce the cost and risk of this transition. The SmartSheet10 technology will make your ICD-10 transition seamless and with minimal cash flow concerns. For questions, please reach us at sales@smartsheet10.com. Once again, thank you for viewing this demonstration.